Dr. Rajkumar. How am I doing today? You caught me here with my new labs.
I think you're doing quite well. After all, you've had your transplant. You seem pretty anxious, but you're on maintenance and you're doing quite well. Everything's going well.
Well, I better be in CR. I'm not one of your patients to complain, but you know, I've already taken a year of my life to go through 4 months of treatment, and then the transplant, and I'm putting up with taking medication every day. You said I should be in CR at this point, didn't you?
Yes, it looks like you have a lot of notes.
Yes. I've got all of my notes from all of these years.
You know, it is a serious disease, so it's a serious cancer, so some side effects occur, and you are in CR, of course, but you know, the myeloma can sometimes come back. It can.
I know, that's why I'm so anxious. You know, every time I see you, you don't seem very confident. You always tell me this thing may come back, but you don't know when it will come back. And I'm really nervous because I've read a lot that many people are talking about something called MRD. So please tell me from my charts, where am I? Do I have MRD? Something like that, tell me.
Looks like you've been on the internet. And yes, we are doing a lot of research with MRD, and let me see your results here. We did the MRD by flow, and you are in CR, but the MRD by flow is positive, and the MRD by sequencing is also positive.
What did you say? What?
You're MRD positive. MRD positive.
How can this be? I feel really good, but I still think this MRD positive, that's not good news. From what I've been hearing, I should be MRD negative.
Well, you know, when we do a transplant, you know, about half the patients get MRD negative, but there are many patients who are MRD positive. It happens.
No. From the research online, many experts write that it's been written that survival with myeloma is excellent if you have MRD negative. But if you're MRD positive, life expectancy is significantly less. Isn't that correct? Doctor, I think you're telling me I failed my treatment or my transplant or something's going wrong. I think you need to figure something else out for me here.
Well, listen, we are doing a lot of research, and many experts go and say about MRD, but they're talking about research projects. I mean, we are still figuring out what to do with the MRD positive.
No, doctor, no, I have my notes. You yourself were on TV. You were interviewed on TV. You have been on YouTube talking about swans, black swans. You said MRD negative is what we want.
MRD negative is what we want, but sometimes patients are MRD positive, and it doesn't mean you failed something. We have to figure out, you know, what to do with that.
What does that mean? What to do with the result? Should you change my treatment maybe? Maybe I should have another drug. You should add another drug. You should help me. Maybe I should take CAR or something like that. CAR, it starts with a C.
No, I don't think you need a car or at this point, but we are still, at this point, I think you should just keep taking your lenalidomide maintenance. You're doing well, you're MRD positive, but that's okay, you can still, we don't know whether we should change therapy or not based on this result
yet. But then why did you do this test? I have to just live with this now? I have to live with being MRD positive, knowing, everyone's raving about how nice it is to be MRD negative, and that is what I want to be.
At this point, I would say that most experts would say that you should just continue on the same treatment. We don't know, we are doing studies to find out how to deal with the MRD positive patient, whether we should change or add. We don't know yet.
We don't know. Doctor, I think I need a second opinion. I've heard some doctors say we should really go after MRD negative.
I'm really sorry, I have some limits because I cannot practice in US and I'm coming from the province, but since can you take some second opinion? Listen first. Please.
I'm very nervous.
I'm trying, yes, first, I agree with you. Don't get so nervous, okay? Things are well today, enjoy it. Don't think about tomorrow and start first. That's very important. That's second. Don't put everything on MRD. You know, things are more complicated than that. Because the biology of the disease could be different. You could have a very good biology of the disease. You could have a very good immune system that is controlling your disease. And at that point, to be MR negative or not to be MR negative is not so important. The important is to maintain a control through time. So some people become MRD negative and might have a relapse in 24 hours. Okay, so, and some other might become MRD positive, and they have such a good immune system, and looking at your eyes, you probably have a very good immune system that will control the tumor for years and years.
Okay.